This is another video with Dr. Jahwari to discuss the indication for this case. This patient is a 77-year-old patient with severe axial pain, but as well radiculopathy that correspond to 3445. We have maximized conservative management, including more than 6 months, actually 9 months of conservative management, and the pain is persisting. So we decided on the fusion. And the patient has spondylolisthesis, and as you see here, foraminal and lateral recess stenosis. And here we see as well that obviously in this picture, patient is laying down, yes, putting no pressure on that. You can imagine that. Yes, here, look at that here. Look at that, yeah, foramen, that its finding is much worse when patient is actually not laying down. Now, here is the CT view, and we see as well in MRI as well as here that patient as well does have significant facet disease. And here we come here, you see the facet, the hugging facet, the dark, the vacuum effect inside of the facet, and here again you see the severe facet disease that you see that there. So, Dr. Jahwari, what do you think about these pictures? What else do you think we should mention about these pictures?
No, I think you mentioned pretty most of the things.
Yeah.
Severe degeneration. I'm sure this patient has facetogenic and discogenic pain.
Yes, both.
With
exactly.
Instability, yeah.
Yeah.
So stabilization is definitely indicated.
Yeah, especially with the spondylolisthesis, the standard of care is fusion here.
Absolutely, yes.
United States, yeah.
Yes.
Well, but we did the surgery. Surgery took us skin to skin actually
35 minutes.
35 minutes before we closed the skin, but
40 with closing.
43 minutes with closing the skin. Our blood loss was a little more than usual today. It was 118 cc.
Okay.
And we measured the sponges before and after, but 118 cc, and we are not even using tranexamic acid that can cause significant cardiovascular problem and cerebral problem actually, because tranexamic acid make the blood more coagulable everywhere. Yeah. And we didn't use a Bowie bipolar suction. So 118 cc of blood loss is pretty acceptable, pretty low, yeah. But I think more important than the picture and what we did is that this patient usually go home within 24 hours.
Yes.
And now that makes sense why we can do this surgery. 4 level of these, we can do it in a 90-year-old person with minimal blood loss and minimal damage, because the shorter surgery, less blood loss, and this surgery was practically 43 minutes. Our average time for a 4 level is 1.5 hours. And now it makes sense. And we don't really rush the surgery. It's just a fast surgery because we don't have to cut the muscle and stop the bleeding and so on. Yes. And additionally, because we are not, I'm going to show the final pictures here again. Additionally, because we are not cutting the muscles and not creating any dead tissue, our risk of infection has been 0.17, whereas usual risk of infection in spine is 3 to 5%.
And you can see how the anatomic decompression.
Here, especially
the
here.
Foramina, how it opens with this 13 mm cage, isn't it?
Yeah. And this patient usually go within 24 hours. 90% of them go home within 24 hours.
I think one of the main keys also, Hamid, the 2C arms.
Yeah, absolutely.
It's helped a lot.
You cannot do this surgery with 1 C-arm.
Yes.
If you have to go back and forth, too many back and forth.
That will affect sterility, not only the duration.
Yeah. But more importantly is that yes, you need 2 C-arm, but you can do 6 of this surgery versus 1 or 2 out of this surgery a day. So meaning that you get the double mileage of those C-arm, even though you need 2 C-arm. You can do way more surgery, but as well, all the staff don't have to stay there for 1 case 6 hours. They stay there for 1 hour. Then you do another case. Okay. Well, thank you.